Okay, I decided to do my case report on the movie Black Swan. I focused mainly on the main character, Nina Sayers, who is trying out for the role of Swan Queen. And in order to be the Swan Queen, you have to perform the part of White Swan and Black Swan. And Nina does an excellent job of playing the part of the White Swan, but she has a hard time trying to get into character of the Black Swan. She gets threatened by another ballerina, Lily, and perceives Lily as a potential threat because Lily does a fantastic job of playing the Black Swan role. And because of this, Nina is determined to fit the role of the Black Swan, and then she gets a little bit deeper into her dark side. The diagnosis I'm going to give her is schizophrenia because throughout the whole movie she was having severe hallucinations, and at the end of the movie she ended up actually hurting herself really bad by stabbing herself in the abdomen, thinking she was stabbing another person. One example is when she went to the restroom to wash her hands, and she noticed that at the bottom of her finger it was bleeding, so she started picking at it and completely ripped her skin down her finger, and then someone had walked into the restroom and she realized that she was hallucinating the whole thing. I think that her disorder got triggered by all the stress she was experiencing and putting herself through to be able to perform the Black Swan part perfectly. She also had a very poor diet throughout the movie because after practices and stuff, she would go to the restroom and make herself throw up. Her mom got her a cake to celebrate her accomplishment on getting the role, and Nina was very persistent on telling her mother that she did not want a big piece of cake, and you can tell by her facial expressions that when she was eating the cake that she was very anxious about the fact that she was eating it. The two main characters that were trying to help her reach her goals were her mother and Lily. Lily was trying her best to get through to Nina, and she came to Nina's apartment and convinced her to go out and have some drinks. Lily did this for the sole purpose of trying to get Nina to break through and let loose a little. But then the next day, Nina saw this as a threat to her and thought that Lily was trying to take her part of the Swan Queen. She also was being very angry at her mother and started acting really differently because she thought that since her mother gave up her career as a dancer, that her mom was jealous of her, that she was reaching her goals. I think that if Nina were to have gotten professional help in the movie, she would have been diagnosed with schizophrenia and an anxiety or eating disorder. I think that because of the culture she was in, all the stress being put on her of performing this part perfectly of the Black Swan, it just really triggered her symptoms of the schizophrenia. One major stigma that is associated with schizophrenia is violence. So whenever we see films and schizophrenia is portrayed as being violent, we view people with it as violent people. The two main symptoms Nina was experiencing was hallucinations and delusions. One example of when she was hallucinating is whenever she went into her dressing room after her first performance and saw that Lily was in there, and she thought that Lily was trying to steal her part, so she pushed Lily into the mirror and shattered everywhere, and then ended up stabbing Lily in the stomach with a shard of glass. And then later, someone knocked at her door, and Nina opened it and realized that it was Lily and that she hadn't really stabbed her. Oh, one symptom that she wasn't experiencing was disorganized thinking. She portrayed that she was perfectly healthy, so no one would have thought anything of it, just the way she was acting. I have provided some further explanations of the definitions behind all of her symptoms. The treatment I would consider Nina to have is that she should get some type of stress management because of all the stress she was going through by performing this part perfectly. I also thought that it would have been beneficial if she could get some education on her disorder so she could understand more of what is happening to her. I also think that she would benefit greatly by getting on some type of medication to reduce her psychotic episodes. Nina matches the majority of the symptoms associated with schizophrenia and the process by which specific situations can trigger specific symptoms of the disorder. So I think that The Blonde Swan demonstrates an accurate portrayal of someone's descent into schizophrenia after reading our chapters on psychological disorders in the DSM. I don't typically agree that every movie depicts mental illnesses as accurately as this one does, because some just over-exaggerate and have misconceptions about certain disorders. And then these are my citations and references. And yeah, that's it.